I have Mr. Fisher here, who is 2 weeks post-op from his left total knee replacement through the subvastus approach, and he is doing extremely well. Mr. Fisher, how would you say you're doing at your 2-week mark?
Great.
Yeah.
Great,
And
better than the last one.
And that's great. And you had your last one done a couple months ago,
Correct.
And how's physical therapy going so far?
Excellent.
Good. And how would you say your pain is at the 2-week mark?
Probably about 2.
Okay, great.
It's more irritation than pain.
That is great to hear. Well, let me have you lay back if you can, and you can just show me how your range of motion is doing so far.
All right.
So this is at 2 weeks, and he can get his leg almost completely straight, and then he's able to bend it up quite a bit at this point. He's also able to do a straight leg raise at this point, if you can just show us how you're able to do that. So go ahead and bend straight up. Perfect. Very good. All right, and you can go ahead and sit back up for me. And he is already at the point that he's able to walk with just a cane. And you said you were able to go to a cane how quickly after surgery?
2 days after surgery. I was using a walker before that.
Okay, that is great. Overall, pleased with your experience at the Outpatient Surgery Center, and that is great. All right, well, thank you very much.
You bet. Thank you.